Let me explain where to start your preparation. When I first started my preparation, I was like you. I had no idea. Seriously, I had no idea. And I couldn't afford to invest in any coaching programs, or I couldn't pay for any coaching because I came from India. I was new to Australia. I did not have money. My dad had to borrow money. So I couldn't afford any coaching, and that time the cheapest coaching program was $7,500 and my exam fees was $3,000 or $3,800, and the costliest coaching program was $25,000. There is no way I could afford even the cheapest one. Forget $1,000 or $2,000. I couldn't afford even $500. So it was a financial thing for me. I know some of you might have the same problem, but I used to struggle a bit. I was a student in Australia. I had no idea. So money was a big thing. So what I had to do is I literally went and this is what I did. So I spoke to educators, and some people were smart. There was a doctor from UK, his name is Terry, and he told me a few things. He said, don't study everything end to end. He was a very smart man. So he said, don't study everything. And he said, focus on what you are not sure. So he said, don't study everything, just focus on topics you're not sure. I thought that was a very good starting point for me. Now I started asking myself, what are the topics I'm not sure? Then medicine is an ocean, as you know. So I thought, I don't know a lot of things in medicine. I don't know a lot of things in surgery. I struggled with examination. Then I struggled with psychiatry. Then I asked another question. In these topics, what is it I am struggling the most? That's when I thought psychiatry was the toughest thing for me. So let me put that with red. Psychiatry was the toughest thing. And in this process, I started asking, other people. So let me just go back. Open another one. So I started asking people who passed and people who failed. So these people failed. So I said, what is it you're struggling in psychiatry? What is it you were passing easily? Because for me, the entire psychiatry was a torture. I hated psychiatry because I think except the depression case, everything else looked very challenging to me. That's the only easiest thing in psychiatry. Even I used to struggle with mental state examination, psychotic case. I have fear even today. Like few days ago, I was talking to a Indian patient who was on methamphetamine, and he was talking about the noises he is hearing, that his wife put a thing in his ear, and because of that he is hearing noises. So I was uncomfortable. So even today, psychiatry is something I'm not comfortable. And things like bipolar, there are all criterias. So it's always psychiatry is the most hated thing for me. So when I was talking to people, everyone had the same problem. They said, we struggled with psychiatry. Every case is a challenge. So I thought, if that's what I hate the most, and if that's what I'm not sure, let me start with psychiatry. And one thing I told myself is every OSCE exam or clinical exam will have a minimum of 4 psych cases, because the OSCE exam is there to filter people, is to fail people, or to see how many people will fail the exam. They need a criteria to fail people. So psychiatry cases are the ones where everyone were failing. So I thought if I can master the psychiatry, I have a very good chance of passing the exam. So that was my mindset. So I thought if I can pass these 4 cases, I have a better chance of passing the exam and be successful. So then what I did is I started studying psychiatry. So okay, so what I did is I started a study plan. I said, how many topics are in psychiatry? I said depression, bipolar, the common things that are asked in OSCE or clinical exam. Then anorexia, or eating disorders, not anorexia, bulimia. So I made a list of all these topics. Then I had like 18 to 20 topics. Means depression has adjustment disorder, then bipolar, had other types of things they asked, then psychosis has, schizophrenia and all that crazy things. Then mental state examination. So that's how I made a list of all the topics. Then what I did is, this is something that is going to help you a lot. Trust me. No one teaches this. I can charge you money for this. So I take, let's say, depression. What I did after depression is I had a specific thing. I opened Google Images. Then I go to YouTube, watch video. Then I used to read articles. The reason I did this might sound very simple or silly, but trust me, when you read Google Images, you will visually remember everything. When you watch YouTube videos, you can actually get all the key points. Then I used to read articles about depression. So I like to do very deep reading. When I read depression, I read it for 2-3 days, because then the last thing I do is I draw a mind map. So now, because I read so deep, for me to forget depression, it is literally impossible. The way I read this is I had it's called kinesthetic or kinesthetic learning or something, where you actually see things, you hear things, and you draw things. When you do this, trust me, you will not forget it. So here the key things was, in all psychiatric cases, is the criterias. So I used to write down all these criterias, and you will not believe that changed the way I look at psychiatry. Psychiatry suddenly started becoming easy to me. So once I finished psychiatry, I got so much confidence. I thought out of 16 cases, let me explain this again. Out of 16 cases, 4 were psych, 3 to 4 were peds, 3 were gynae obs. This number might not be exactly right, but this is how I was thinking. And 2 to 3 were examination, and 2 to 3 were emergency. How much is that? 3, 4, 7, 10, 13, 16 roughly. And this had medicine probably here. Maybe there was a medical case here, or maybe psychiatry were 3 cases. I think 3. And 2 to 3 we used to get examinations like cardiovascular examination, respiratory system examination, or cranial nerve examination, you know, things like that. So when I was preparing like this, that's when I got this light bulb moment. I thought, if I mastered psychiatry, how about I do the same with peds? So let me master peds. Then I thought, let me master gynae obs. So suddenly my confidence increased because I mastered examination. So I know that I'm going to do the examination case as well because I practiced it in the hospital on the real patients and on pillows and dummies and everything. I practiced them so much. I passed. I know that I have all the psych cases. Then I know that I mastered all the pediatric cases. I mastered all gynae obs cases. Now I was only left with medicine cases. Surgery cases are easy. No one will ask you to go and do a surgery on the patient. They are very easy cases or silly cases. So I thought already I passed my exam because I figured out the psych cases, the pediatric cases, the gynae obs cases, and I figured out examination. And because I was very confident, now preparing for medicine was very easy. And I know in medicine, because I mastered all the other things here, because I mastered all these, I know that all I have to do is, out of 4 cases or 2 to 4 cases in medicine, I have to pass 2. And even if I fail all 4, I will pass the exam. So this is a big secret. I know, some of you might say, it is silly secret. That's okay, but this is my mindset, or this is the thought process I used to have. And this is what made me pass not 1, not 2, all 16 cases, in my exam. I passed all my 16 cases in my OSCE exam because I had a strategic approach. I had a thought process that gave me confidence, that gave me a very clear plan on how to prepare, what to prepare. And I hope this was helpful. If it's not helpful, then that's okay. Or if I wasted your time, very sorry for that. I believe this one will work for anyone. And if you want to get my mind maps, like all the mind maps or my notes and things, I made them into mind maps and I actually put it in a book. So if you want to get that book, you need to click the link under this video, and it will save you so much time. Trust me, it will save so much time, because to figure out all those mind maps, I spent weeks, months, not days, or you can even say year. So if you want to save time, that mind maps are ready for you. You don't have to go and create these mind maps, because I have already have my mind maps, like history taking mind maps, medical examination mind maps, and all the symptoms like palpitations, what are all the causes you need to know. So everything I put into mind maps, and actually I am selling it as a book, and it's a ridiculously cheap price. Trust me, that book will save you so much time and make you a better doctor. And if you like that book, and if you like the way I'm teaching, you will surely love everything I'm selling. And there are lots of secrets and strategies I teach. So I wish you all the best, and I will see you in another video.